Hello, and welcome to Art from Heart Beyond the Canvas. I'm Avni, the founder of Art from Heart, and today we'll be diving into the world of art and therapy. We're really thrilled to have Miss Sheela Ivlev as our guest. Miss Sheela Roy Ivlev is an occupational therapist specializing in mental health and wellness. As a Bengali woman born and raised in San Francisco, the ancestral homeland of the Ramaytush Ohlone people, she understands health and wellness from diverse perspectives and values the connection of culture and healing. She is the founder of Todoish, OT Bay Area, WellWorks Consulting, and Disrupt OT, an international volunteer-based organization disrupting the status quo of systemic oppression in healthcare, building community, highlighting global voices, and providing free education to healthcare users, students, and practitioners worldwide. Thank you for joining us today, Ms. Ivlev. We're really excited to have you as our guest and share your journey with our audience.
Thank you for having me, and thank you for all the work that you're doing. I'm super impressed.
Thank you. Thank you so much. All right, so first, I would just like to ask you what inspired you to pursue your field?
Yeah, so occupational therapy is in the healthcare field. We are considered licensed medical professionals, and I always thought I wanted to be a doctor as a kid. I grew up going to India, and I could see that stark contrast between opulent wealth and poverty. And I always knew I wanted to do something to help people, but I didn't end up pursuing that after college. So I had some kind of detours where I worked in nonprofit and corporate quality assurance, and a close family member of mine here in the US lost his life to something that was treatable. And so that kind of sparked in me that I want to go back into healthcare. I want to make a difference. I thought I wanted to change things from within. So after finishing college and going back into healthcare, usually you need an additional degree. So I looked at what some of the options were, and I had pursued physical therapy and occupational therapy. You have to do volunteer hours before you can apply to grad school. So I gave both of those a try, and occupational therapy just seemed very holistic. It took really everything about the person, their support system, even like their culture, everything that's important to them. It took that into account. So for me, that was I knew that was really it.
Wow, that's really inspiring. How did you know that occupational therapy was like the thing that you wanted to pursue in healthcare? Like, did you try other things in healthcare or learn about other
Yeah, so
pathways?
growing up, I had looked into like what it takes to be a doctor, so I kind of
Mm,
understood that pathway.
yeah.
I did like my undergraduate work was basically to be able to apply to medical school, so I had
Okay.
some idea of the medical profession. In high school, I volunteered at a
Mm.
hospital. I was just a menu taker, so I took
Oh,
people's
okay.
like what their breakfast, lunch, and dinner orders were. But I got to meet patients. I got to see how some things worked in the hospital, so I had a little bit of an understanding. But I actually didn't know what occupational therapy was. It literally was just like an internet search.
Oh,
Um,
wow.
and the good thing is the programs require you to do these volunteer hours and shadow so you can see. So I was able to follow around a physical therapist, and I was able to follow around an occupational therapist in different settings. And so I got to see the difference in what they did with patients, how they treated patients, what areas they were focusing on. So I think that was like a big deal to actually see it in action, because you can look it up, you can hear these interviews, but you don't know until you actually see it.
Oh yeah, that's very cool. And yeah, I agree that shadowing someone in healthcare. I mean, I'm
Mhm.
also actually interested in pursuing healthcare when I'm
Yeah.
a field in healthcare when I'm older. And right now I do want to be a doctor as well. So I do understand that shadowing people is very important to understand like the day-to-day workings of like the hospital or whatever setting the
Yeah.
person is in. So, yeah.
And what you're doing is really important too. So just having like an informational interview, I
Yeah.
highly recommend really anybody at any stage. I have a lot of people reach out to me and they just ask me to learn about my profession, because that's something they're kind of interested in pursuing. And
Yeah.
so you can ask the real questions, right? Like, how
Yeah.
much time do you spend with patients? Is it what you thought it would be?
Yeah.
And so I think it's really important to ask those things, because especially something like becoming a doctor, it's a huge time and financial commitment. You have to sacrifice a lot of things, and so you want to make sure that that is something that that you really want it to be, and is really a good fit for you.
Yeah, that's very true. Yeah. I mean, I appreciate you joining me today and having this conversation. So, yeah. Awesome. So, now I wanted to ask you kind of how creativity is an important aspect of your field and where do you draw your inspiration from to be creative?
Yeah, so the cool thing about occupational therapy is that it requires you to problem solve in creative ways. If you're doing like traditional occupational therapy in, say, a psychiatric hospital setting, there's actually a lot of arts and crafts involved. Arts and crafts have been a big part of rehabilitation
Mm.
services since the start of occupational therapy. Actually, kind of it was the start of how occupational therapy happened during war. And so it's really just a part of what we do. But I want to say that I'm actually not very talented as an artist or a musician, and so I'm not great at creating art. But I'm very curious by nature. I love to problem solve, and so I get to use creativity, I think, in a different way than some of my peers. A lot of my
Mm.
occupational therapy peers create beautiful things, and I'm like super inspired, but I'm not very good at that. That's the truth. And so I work with adults in mental health. That's my area of
Mm.
specialty. And so I help people problem solve every day, kind of issues, things that they're struggling to do, that they really want to do. And so it's pretty cool because my creativity is sparked by one wanting to help them problem solve, them to be able to meet their goals, but also working with them to figure things out. And I would say, like I mentioned, I'm curious by nature. I think just kind of who I am. English was my third language. I'm also neurodivergent, so I think just growing up, I thought and explored differently than other people. And so, as an occupational therapist, it's a great opportunity for me to be able to use my brain to solve problems. I work with adults, people that have been trying to solve these problems for themselves their whole lives, right? And so I can't just come in and say, oh, do these things that, I read in a textbook or a study
Mhm.
or something, because they've looked everything up, they've tried everything. And so I have to find a different way for them to solve a problem because they've been trying their whole lives to figure it out.
Mm. Yeah, no, I totally agree. I mean, I think most people think creativity is really just like visual or performing
Mhm.
arts, but that's so true. I mean, any kind of like problem solving
Mhm.
itself is creative, and I think that almost every field like you have to use creativity in one way or another. And
Yeah.
I mean, I think it's super cool that you have to always like think outside the box and always like come up with a really personalized like solution for someone or like some kind of approach for someone. So that's very cool.
Yeah, it's fun. It's super rewarding, of course, right?
Yeah.
The work that I do is in people's homes and communities. So I
Mm.
work with people kind of longer term than, say, a hospital stay. Sometimes you only see people for like 2 or 3 days. So I get
Hmm.
to see people for weeks, months, sometimes even a little bit longer. So I get
Mm.
to see how those solutions actually work in their life, and like that's just
Yeah.
super rewarding.
That's very nice that you get to build like a long-term connection with
Yeah.
people. So that's really great. Yeah. And I mean, I'm assuming like you must be having so many interactions with so many different people. So what would you say is a really memorable or a challenging moment in your journey, and what did you learn from it?
Yeah, I mean, I think like one of the biggest moments probably for just a lot of people was COVID-19. I mean,
Mm.
not that it's over. Obviously, people are still
Yeah.
impacted by the virus, but in the early days, that's when I started my practice. I have my own community mental health practice, and so there were just a lot of things. From like professional perspective, and then I also am a caregiver. Was taking care of my dad before he passed, and then my mom also had a stroke during that same time. And so
Oh, okay.
juggling how do you be a clinician and do your job and help people, everyone was really struggling extra,
Yeah.
right, during that time. And also taking care of my parents and keeping them safe, keeping my patients safe, keeping my family safe.
Mm.
And so I really had to learn how to adapt. And then that kind of creativity thing came back in. How do I find community, build community? People were lonely. People were struggling with their mental health and like looking for ways to support themselves when they were stuck at home and they were uncertain about like really the future and what was going on. And so I had to figure out, okay, how do I still see people? How do I bring people together and try to teach them skills that can support them during this time? And so I did a lot of like virtual work. I connected with a lot of clinicians around the world at the time, because you're kind of stuck at home and you're craving that community and connection. And so I think it was really hard, and I don't want to downplay what has happened since the onset and is still happening. People are still getting COVID-19. People have lost their lives. But I think there were a lot of things that were kind of exposed in like healthcare. A lot of the inequities were really, really clear to people. So we learned that, but we also learned different ways to build community, different ways to provide care that actually kind of patched some of those gaps, right? People that couldn't afford access, people that couldn't get to hospitals, right? Hospitals have been being shut down in lots of different communities of color and things like that. And so I think that I learned a lot. I met a lot of great people, learned how to do things with very little resources, and like really just kind of had to experiment and see what worked and what didn't work for people.
Yeah, wow. I mean, I imagine that must have been very hard. Like, of course, it was the pandemic, and then you were juggling like caregiving and also your job. So, I mean, that's pretty insane. And also, I think it's interesting that you mentioned how the pandemic, which like arguably still ongoing a little bit, but how that may have also even had a positive impact on like healthcare and how the healthcare system may have actually improved from it. And I also hear a lot of people say how COVID also forced a lot of our work in person to become virtual,
Yeah.
which of course had like downsides, like not as much in-person connection, but now a lot of things are still virtual, like our meeting today on Zoom,
Yeah.
and it actually might be more convenient for people, and of
Right.
course like the rise of AI and everything. So I think that it's really interesting that you brought that up. So yeah,
I mean, I kind of see it as adaptability. Obviously,
yeah,
a lot of people didn't have access to care. A lot of
yeah,
people didn't have information, and so no amount of adaptability is going to help you survive if you don't have the resources. But people that had access to resources and means and some power to do something were able to adapt things and like you said, learned how to give people more access
yeah.
to care or flexibility to work and do things that people didn't really think of before because we didn't have a choice at the time.
Yeah, exactly. Yeah, that's really interesting. All right, this next question is a fun one, but if you could collaborate with anyone, who would it be and what kind of project would you do together?
Yeah. So I think I feel like maybe my answer is a little boring because I don't really have like a famous person
Oh yeah, no,
or
no,
a
it can be
well-known person
anyone.
in mind that I
Yeah.
would want to collaborate with. I'm pretty lucky that my work requires collaboration. Like
Mm-hmm.
I have training and education, but like I'm not the expert in anybody's life. So all the things that I do in my work, I get to do with other people. Like I don't get to sit in a silo and say, okay, this is exactly what do research and this is what needs to be done. Like I work with people and figure out what works, what do you want to do, what works for you, how let's trial and error how to figure out how it works. So I think like where I'm at right now, I'm building a tool that helps with executive function, basically people that are like stuck with doing tasks that they need to do every day. And so as we add more features to it, I'm building this with people that need this kind of help. And so for me, what I want to continue doing and doing more of is collaborating with people that have like lived experience, people that are experiencing overwhelm, not just that are neurodivergent, not just that have certain mental health conditions, but just a lot of us are overwhelmed for different reasons, and trying to problem solve with them and find solutions with people. So kind of collaborating through lived experience, if that makes sense.
Hmm. Yeah, that's interesting. I mean, yeah, I think anyone who has some kind of a lived experience or some some kind of unique perspective would have something new to share. And yeah, I think collaboration is really important. And I think it's cool that in your work you do get to kind of collaborate as a team to figure out a solution. So yeah, that's nice. Awesome. All right, and our last question today is what advice would you offer to young people pursuing creative or professional passions?
Yeah, I think, I mean, I'm thoroughly impressed with young people. Obviously, what you're doing, I've read so many stories of, young people like in high school, some even in middle school, inventing things, right? I feel
Yeah.
like younger generations really care about other people in the future and want to do something about it. And so I think it's never early to explore. And so, before there was the you have to get your degree before you do all these things, and now
Mhm.
you can intern, you can you have your podcast, you already have a nonprofit, like that's amazing. And so you can be of service, you can do things without having to have even finished school yet, right? You can
Yeah.
pursue them at the same time. And so if I mentioned this earlier, I think something like an informational interview is huge, really, for anybody at any age that is considering doing something, because
Yeah.
informational interviews have gotten me actual paid jobs. You can learn things, you can volunteer, you can form like networks and connections with people that in the future, when you're ready to pursue that, you can come back and those people will remember you, right? They'll remember your passion, they'll remember how engaged you were. So I think some of the things that are like super important if you're looking to pursue something that requires additional education and like a financial commitment, is to ask questions like, how much is this going to cost, right? Like over the 4 or 8 years, whatever it is that you're pursuing, how much is it going to cost, and how much am I going to make as a salary? So kind of doing that math of how long is it going to take to pay off, because nobody tells you those things, right? You can look
Mhm.
up how much a salary is, but you don't realize how much student debt you're going to be in, and
Yeah.
sometimes those aren't entry level salaries. So and also just kind of understanding what mentorship is like in certain positions. I think it's really important for people to be able to have support in order to be able to excel. And there are certain areas, especially professionally, where you might like get a degree and then just kind of be thrown in. And so you have to, sink or swim, versus
Yeah.
having additional training and support, I think, is important. I talked about equity. And so I think just being real, like interviewing, I've had a lot of like South Asians or Asian students reach out to me to understand, or students of color really, to ask what it's like to be an occupational therapist, because sometimes in some professions this is true. There's bias, there's discrimination. And so understanding what somebody with like that looks like you or your identity, what they might experience if there's nothing to worry about, or if they might have extra obstacles, and if there's supports to help get you through it.
Yeah.
Um, you mentioned wanting to be a doctor. I don't want to dissuade anyone from being a doctor. Doctors save lives. We need doctors. Um, Everybody needs a doctor, but nowadays doctors spend a lot of time on paperwork than patient
Mm.
care. And so I personally have no regrets that I didn't become a doctor, because I spend a lot of time getting to know people, patients and clients. And so, things like that, it's hard to find that information. So if you talk to
Yeah.
somebody about it, I think that's really helpful. And I would say, I guess, like the last piece of advice is, nothing is a waste of time. Like if you pursue something and you realize that's not really your passion, you're going to learn something from it. You're going to learn
Mm.
what you like, what you don't like. Maybe you'll learn what's important to you, and you can build on that. So, I thought I wanted to be a doctor. I went into nonprofit. I went into corporate. a lot of the things that were like, oh my gosh, I never want to do this again, pushed me towards what I wanted to do. So now I'm an occupational therapist, I'm a clinician, I do consulting, and then I'm, building a tech solution, all from the things that I've learned like throughout my life and my career. So none of it is a waste of time. So like go for it really would be my piece of advice.
Yeah, that's really great advice. I mean, as a high schooler, and like yeah, we were chatting about how I want to be a doctor. I I totally agree that like it's really confusing right now, like navigating what to do, or even like just within healthcare, like what I'd want to do because there's so many pathways besides just being a doctor. And of course, like we don't want to lock ourselves into something too early, and like it's really important to explore. So, yeah, I think that advice is really good to, follow your true passions and what you like. So,
Yeah, and
yeah.
if you can volunteer, like if you can find a way to get involved, I think that's great. Even if it's not
Yeah.
required of you, you get to see it firsthand.
Yeah.
And kind of volunteering is one of the best ways to get in, right? People are busy at work, and if you offer to help them, they're usually excited to have you. So,
Yeah. That's very true. Yeah. I mean, just volunteering itself is really like fulfilling and like
yeah.
it's a great thing you can do for your community. So, I mean, yeah, that's very true. All right, great. Thank you so much, Miss Ivlev, for sharing your incredible journey and your insights with us today. And it's really been a pleasure hearing about your experiences and the passion that you bring to occupational therapy. And I'm really sure that our listeners have gained a lot of valuable inspiration from your story. And to everyone tuning in, thank you for joining us on this episode of Art from Heart Beyond the Canvas. We really hope you enjoyed this conversation as much as we did. Be sure to subscribe and stay connected for more exciting episodes exploring the intersection of art and creativity in all its forms. Until next time, stay creative.